Welcome to Dr. Khares Differential Diagnosis. Today we are going to learn mixed radiopaque and lucent lesion on dental radiographs. Let's go to the normal structure first. These are the radiographs showing calcifying crown of developing teeth where A is mandibular right second premolar and B is mandibular left third molar. This maxillary periapical radiograph shows root tip with accompanying rarefying osteitis. These are the periapical radiograph showing combined periapical rarefying and condensing osteitis. The teeth in the three cases were non-vital. The rarefying osteitis contacts the root end, and the condensing osteitis, which is a radiopaque hollow, is located around the periphery of the rarefied area. These are the periapical radiographs showing periapical cementosseous dysplasia in the intermediate stage in the periapices of teeth with vital pulp. These are the pictures showing intermediate stage of fibroosseous lesion of periodontal ligament origin, where radiograph A is periapical cementosseous dysplasia, while radiograph B is focal cementosseous dysplasia at the periapex of the first molar, while the picture C is microscopic study showing the small separate masses of cellular cementum, which is the characteristic of this lesion. This is the panograph showing cementoossifying fibroma, where arrow shows the large well-marginated radiolucent lesion with radiopaque foci involving the roots of mandibular second molar tooth. These are the radiographs showing rare periapical mixed lesion, where radiograph A is of compound odontoma at the apices of second molar tooth, a most unusual location, while radiograph B and C are of calcifying odontogenic cyst in the canine region of 14-year-old girl in radiograph B and in the maxillary incisor region in the radiograph C. The unusual radiopaque lesion has caused root resorption. Some more rare periapical mixed lesion, where radiograph D is a mixed radiolucent and radiopaque lesion at the apex of the non-vital central incisor. The lesion was basically a pulpoperiapical lesion, and the rectangular radiopaque image was the mesial segment of the crown of the other central incisor, which has been broken off in a traumatic incident and driven up into the tissue. Now the radiograph E shows several radiopaque foci of root canal filling material within a periapical radiolucency. This is a panograph of cementoblastoma in the intermediate stage at the apex of distal root of the vital first molar tooth. In this table, you can go through distinguishing features of mixed radiolucent and radiopaque periapical lesions. Now let's talk about the pericoronal mixed lesion, where these radiographs are of intermediate stage of odontoma. Radiograph A shows compound odontoma. The washer effect is produced by partial calcification of the teeth, while radiograph B shows compound complex odontoma causing impaction of the molar, and radiograph C is of compound odontoma. This radiograph shows pericoronal intermediate stage of odontomas associated with an impacted mandibular canine. In the radiograph B, minimal calcification has occurred in this odontoma, which is shown by the arrow, located pericoronally in the maxillary first and second molar region. These are the pictures showing adenomatoid odontogenic tumor in the intermediate stage seen as a pericoronal radiolucency with radiopaque foci. Radiograph A is a case in maxillary canine region while B is a different case in the upper premolar region. Picture C is a photomicrograph showing dark foci of calcified material. These are the pictures showing pericoronal calcifying odontogenic cyst with radiopaque foci within the cyst-like radiolucency. Radiograph A and B are of the same case. Radiograph C is panograph of the different COC, while the picture D is photomicrograph of a COC and a keratinizing odontogenic cyst. Nodular formation of keratin and ghost cells within the epithelium of the cyst wall is evident. Calcified tissue can be observed at the inferior aspect shown by the arrow. These are the radiographs showing ameloblastic fibroodontoma, where radiograph A is panorex radiograph and radiograph B is periapical view. The radiopaque foci within the radiolucency are associated with the crown of impacted first molar. These are the pictures showing pericoronal calcifying epithelial odontogenic tumor. In radiograph A, an embedded premolar tooth and small radiopaque foci are seen within the radiolucency in this occlusal view of the mandible of a 57-year-old man. Radiograph B is the lateral oblique radiograph of a 77-year-old woman showing a mixed radiolucent radiopaque image in an association with an embedded molar tooth. Picture C and D are photomicrograph of calcifying epithelial odontogenic tumor. The pleomorphism of epithelial cell is evident in picture C. In picture D, clear epithelial cells and calcified materials can be seen. This is a radiograph showing cemento-ossifying fibroma. The radiograph is of a surgical specimen showing the well-defined borders of fibroma and the displaced third molar. These are the radiographs showing cystic odontomas, where radiograph A is orthopentamograph showing an odontoma within a large dentigerous cyst, while radiograph B shows cystic odontoma in an intraradicular location between the lateral incisor and canine tooth. You can go through this table showing distinguishing features of mixed radiolucent radiopaque pericoronal lesion.